Welcome to the Nursing Care Plan online education module. This online education module is based on our practice support tool, Nursing Care Plan Guidelines for Nurses, located on our website. In this module, we will discuss the NSCN mandate, the definition of a nursing care plan, predictability and complexity of clients' needs, the nurse and the nursing care plan, including nursing roles for the RN and LPN, client assessment, development, implementation, and evaluation of the nursing care plan, pre-printed care plans as an example of one type of nursing care plan, nursing care plans versus service plans, and the nursing accountabilities in the development, implementation, and evaluation of them. The module will conclude with some key points from the presentation. The Nova Scotia College of Nursing mandate is to serve and protect the public interest, preserve the integrity of the nursing profession, maintain public confidence in the ability of the nursing profession to regulate itself, and to set and monitor standards for the profession. LPNs, RNs, and NPs registered with NSCN provide nursing services to Nova Scotians.
Nursing care plans are an individualized and comprehensive plan guiding the nursing care for a client. The purpose of the nursing care plan is to enhance communication between care providers so care is provided consistently and client goals are achieved. The Nursing Act requires that nurses ensure there is an appropriate nursing care plan developed for every client, regardless of the practice context. All nurses have this accountability that is based in legislation and is not negotiable. How the plan looks visually may not be the same in every context and is defined by employer policy. The nursing care plan may be a discipline-specific standalone document, or it may be one component of a broader interdisciplinary plan of care incorporating knowledge from nursing, health science, and other disciplines. The nursing care plan includes priority problems, nursing diagnosis, client goals, nursing interventions required to meet the identified goals, and evaluation of the client's response to the plan or interventions within the plan.
The nursing care plan is developed in collaboration with the client and reflects the priority needs on admission and throughout the duration of the client's care. As the client's needs change, the nursing care plan evolves over time. The nursing care plan is part of a legal medical record. The employer determines the format of the nursing care plan, whether that is written, electronic, or pre-printed depends on the employer context of practice. In addition, the employer is accountable for implementing policies or other processes to support the development and utilization of a nursing care plan, whether it is nursing specific or interprofessional. The client's level of predictability or complexity is established in the nursing care plan. Initially, the level of predictability or complexity is determined through the assessment or interpretation of assessment data on the client and the client's response to interventions. The assessment data can be collected by an RN or LPN. Client predictability and complexity are key factors for consideration when determining the most appropriate nurse to care for a client. It is important to recognize the level of predictability or complexity can change based on a client's response to an intervention or a change in their needs. While the RN is accountable to determine the initial level of predictability or complexity, all nurses have a role in evaluating the client's ongoing needs. Nurses are responsible for their practice and the decisions they make at all times. LPNs and RNs are autonomous practitioners with the professional authority to make independent care decisions with some differentiation based on scope of practice. LPNs practice autonomously within collaborative relationships with other care providers, namely the RN, While there is shared practice between the LPN and RN specific to the nursing care plan, there are also practices unique to the RN. The unique practices are a result of the differences in the knowledge bases and professional scopes of practice of the LPN and RN. Grounded in legislation, LPNs work in a collaborative relationship, typically with an RN or physician. One component of their responsibility is to be a partner in the development of the nursing care plan. During a shift or part of a shift, an LPN can work autonomously in a collaborative relationship or in a guided or directed manner when the needs of the client change due to a change in the client's health status or when the client is not meeting expected goals as outlined in the nursing care plan. The level of autonomy varies and is based on needs of the client, supports in the practice environment, and professional scope of the nurse. As the clients become more complex or supports in the practice environment diminish, the obligation to collaborate with the RN increases. It is important to remember that legislation guides this accountability for LPNs to work collaboratively. RNs also have the accountability to be available to collaborate with the LPN. This collaboration may not always be in person and should be outlined in the employer policy to help support nursing practice. Documentation of the collaboration and communication is a shared accountability of all nurses. These unique RN practices in the nursing care plan are a result of the differences in the knowledge base and professional scope of the RN. The RN accountabilities include develop the initial NCP, develop additional plans to address unexpected, new, or worsened problems, identify and coordinate the initial care resources, referrals, or care to support the client to achieve their goals, customize nursing interventions to manage complex or high-risk issues, evaluate the overall effectiveness of the NCP. All nurses share accountability for determining and documenting collaboration and communication as required. Assessments are comprised of two functions, data collection and data interpretation. The client assessment is critical to the nursing care plan. It creates both the foundation on which the plan is created and the benchmark to which the plan's effectiveness is measured. Nursing care plans cannot adequately be developed or evaluated if there's no client assessment. Both LPNs and RNs are authorized to perform client assessments. With a broader scope of practice and in-depth nursing knowledge base, RNs comprehensively analyze, interpret, and independently act on the findings of the assessment. This is very important when clients' needs are not fully understood, variable, or rapidly changing. LPNs may perform client assessments in any context. For clients with an established nursing care plan, that provides a benchmark. This guides LPN's professional capacity to analyze, interpret, and independently act on the findings. When assessment findings are unexpected, variable, or rapidly changing, they have a professional obligation to consult with the RN. Once the assessment is complete, the process of developing the nursing care plan begins. The roles for the development of the nursing care plan vary for LPNs and RNs. This is based on the differences in their professional scopes of practice. LPNs are authorized to develop an initial nursing care plan in collaboration with the RN, or develop a draft nursing care plan which gets validated by the RN. RNs are authorized to independently develop initial nursing care plans in all contexts. The RN or other healthcare providers, including the LPN, may collect data. As part of their analysis of the data, the RN is responsible to ensure it is valid, relevant, and consistent with the client's overall presentation. If the validity of the data is in question, the RN should have the data recollected or recollect the data themselves. Validation is a collaborative process between the LPN and RN. The LPN is responsible to present the draft nursing care plan based on initial assessment findings, pertinent clinical data, interventions, and outcomes. The RN is responsible to review the plan, ask questions, and/or suggest alternative assessments, interventions, or outcomes. The plan is validated when both nurses are satisfied that the nursing care plan is sufficient to meet the needs of the client and this is documented in the client's record. Regardless of the process, the RN is responsible to analyze and interpret the initial assessment data and identify or ensure an identification of priority problems. In contexts where the RN is not part of the care team, LPNs collaborate with the most appropriate care provider to contribute to the interprofessional plan of care. Healthcare professionals outside the nursing profession cannot validate a nursing care plan. The roles of nurses vary during the implementation of a nursing care plan. This is based on the context of practice. Implementation by LPNs are either in a collaborative or autonomous manner with communication to an RN. In practice, LPNs would collaboratively implement the nursing care plan with the RN on newly developed or changed nursing care plans, and LPNs would autonomously implement when the NCP is ongoing and the client is meeting their established outcomes or a revision is completed because the client is achieving the intended outcomes. LPNs are obligated to communicate the revisions that were made to the RN in a timely manner. For example, a reduction in the frequency of an assessment parameter, such as vital signs, because the frequency of assessment is no longer warranted. As the client's needs become more complex or variable, the LPN's professional obligation to collaborate increases because the complex issues must be analyzed with the RN to determine their relevance. Once issues are understood, the nurse is revising nursing care plan as required. Implementation by RNs is autonomous in any context and collaborative with the LPN with new or changed nursing care plans and when revisions are made by the LPN. The purpose of evaluating the nursing care plan is to determine if the client is meeting their established goals. Evaluation compares the findings of the comprehensive assessment of the client to the expected outcomes in the plan. Due to the professional scopes of practices for nurses, the roles specific to evaluation vary for the LPN and RN. LPNs evaluate collaboratively and autonomously. Collaboratively when the client's response vary, and autonomously when the client's response to interventions are in the nursing plan of care and are as expected. RNs autonomously evaluate the client's response to the interventions, the overall effectiveness of the nursing care plan, and analyzes the situation and makes necessary changes to the plan or goals when a client is failing to meet goals. The evaluation of the overall effectiveness is done by reviewing each problem and associated interventions to ensure the issues are resolving as expected and the client is progressing towards the overall goals of the nursing care plan. Employers are responsible to determine the type of nursing care plan tool that best meets the needs of their clients. Pre-printed care plans, example care pathways, care maps, or standardized care plans, are appropriate for use in a variety of settings and are one type of care plan that is used by employers. Despite these being different formats, the principles underpinning the role of the nurse still apply. Nurses may select a pre-printed care plan from the list of available care plans for a client. However, the RN is responsible to ensure it is sufficient to meet the unique or individual needs of the client. Validation process. LPNs may implement standard interventions associated with a pre-printed care plan before it is validated as long as the RN is aware. The RN, or the LPN and RN in collaboration, is responsible to customize standard interventions as needed. Nurses in all practice settings need to understand the differences between nursing care plans and service plans and the accountabilities of LPNs and RNs in the development, implementation, and evaluation of them. A service plan is not a nursing plan of care. A service plan outlines standardized activities of daily living, ADL, or instrumental activities of daily living, IADL, that support clients living in their home. Service plans are only appropriate for use in contexts where the client needs are limited to home support care or retirement living. All nurses are authorized to independently develop, evaluate, and modify service plans. Employers should have clear authorizing mechanisms in place that outline the steps that LPNs should take when the client's health needs change and exceed their scope of practice, especially if an agency does not employ RNs. In home care, for example, the LPN may communicate changes or concerns to the family or the client primary care provider. Service plans should be evaluated on a regular basis based on the organizational authorizing mechanisms or when there has been a change in the client's healthcare needs. Nurses are accountable to collaborate appropriately with the appropriate healthcare provider and/or according to organizational authorizing mechanism if the needs of the client have changed. A service plan needs to become a nursing care plan when a client's condition unexpectedly deteriorates, requiring medical intervention, and the focus of care changes from assistance with ADLs, IADLs, to helping a client meet a healthcare need. The RN is accountable to ensure that the changes from a service plan to a nursing care plan are appropriate for the client. The LPN can participate in the change in collaboration with the RN or make draft changes which the RN must validate. And finally, key points. Nursing care plans are a core function of nursing practice and include the development, implementation, and evaluation of the plans. Nursing care plans are developed for all clients and help to ensure that the clients receive safe, competent, ethical, and compassionate care. It is essential that nurses understand the important role that they have in the process. Thank you for participating in this online education module. We encourage you to reach out to the practice team at practice@nscn.ca should you have any questions.